Lung cancer diagnosis can be very scary and confusing. Learning more about lung cancer can help. Here, we'll give you a brief overview of what lung cancer is, risk factors for lung cancer, how it's diagnosed, what stage means, types of lung cancer, how treatment is planned, common treatments used, and where you can go to learn more. Keep in mind, your cancer treatment team members are there to help you with any questions or concerns you might have. Lung cancer starts in cells that make up the lung. The cells are damaged or mutated and grow out of control. Over time, they can form a tumor and affect how your lung works. Lung cancer can spread from where it first started to another part of the lung, to your other lung, and even to other parts of your body. A risk factor is anything that increases your chance of getting a disease. Smoking is by far the biggest risk factor for lung cancer. Other risk factors include exposure to secondhand smoke or regularly being around people who are smoking, certain chemicals, including radon, asbestos, and arsenic, at work or in your home, radiation to treat other cancer in the chest. Being over the age of 65 or having a family history of lung cancer also increases your risk. Cancer screening tests like mammograms and colonoscopies are used to look for cancer in people who don't have symptoms. They can help find cancer early, when it's small and hasn't spread. This is when it's easiest to treat. Experts recommend lung cancer screening with a yearly low-dose CT scan. This is recommended for people age 50 to 80 who have a 20-pack year or more smoking history and currently smoke or have quit in the last 15 years. You can figure out your pack year history by multiplying the number of cigarette packs you smoked each day by the number of years you smoked. Ask your healthcare provider if this screening is right for you. The best way to prevent lung cancer is to not smoke and to stay away from other people's smoke. If you do smoke, quitting can lower your risk, no matter how long or how much you've smoked. But quitting can be hard, so get help. Ask your healthcare provider about resources that can help you quit. Other organizations can also help you quit. Lung cancer can cause coughing, breathing problems, chest pain, and frequent lung infections. If you have risk factors and symptoms like these, your healthcare team may recommend you have an imaging test, like an X-ray or CT scan. This can show if you have a tumor or mass in your lung. In most cases, the only way to know if a lung change is cancer is to do a biopsy. This is when a piece of the changed tissue is taken out for testing. The removed tissue is sent to a lab for testing. The tests can show things like the type of lung cancer, proteins on the cancer cells that help show if immunotherapy will help. Your healthcare team might also ask to have biomarker testing done on your tissue sample. These tests look for gene changes in the cancer cells, like those listed here. This helps your healthcare team know if certain targeted therapy treatments may be an option. A key part of diagnosis is staging the cancer. Stage tells how much cancer there is and if it is spread. Your healthcare provider can tell you more about the cancer stage and what it means for you. There are two main types of lung cancer: non-small cell lung cancer and small cell lung cancer. Part of diagnosis includes finding out the type of lung cancer. This is important because they're treated very differently. Non-small cell lung cancer is the most common type. It tends to grow and spread slower than small cell lung cancer. Subtypes of non-small cell lung cancer include adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. All the subtypes of non-small cell lung cancer tend to be treated much the same. About 1 out of 10 people with lung cancer have small cell lung cancer. It grows quickly and, in most cases, has spread by the time it's diagnosed. Your healthcare team will recommend treatment based on the type and stage of the lung cancer, your overall health, your lung function, and your treatment goals. Common lung cancer treatments are surgery to remove the cancer, radiation to kill the cancer cells, shrink a tumor, or relieve symptoms, chemotherapy, which uses strong drugs to damage and kill cells that grow fast, like cancer cells, targeted therapy that focuses on changes on the cancer cells to kill them while limiting damage to healthy cells, immunotherapy drugs that help your immune system find and destroy cancer cells. Researchers are always finding new ways to treat cancer. These new treatments are tested in clinical trials. Taking part in a clinical trial gives you access to the newest advancements in treatment. Before starting treatment, talk with your healthcare team to find out if there are any clinical trials that might be right for you. In many cases, more than one kind of treatment is used. Your healthcare team will talk with you about which options are best for you and why. Cancer treatments can damage healthy cells along with cancer cells. This can cause side effects. Side effects depend on the kind of treatment you get. Take notes about any symptoms or side effects you have and talk to your healthcare team about them. There are often things that can be done to help you feel better. Ask your healthcare team what to watch for and when to call. Know how to get help after office hours and on weekends and holidays. Your healthcare team will support you every step of the way. To learn more about lung cancer, including tips for coping with lung cancer, visit www.cancersupportcommunity.org/lung. You can also call the Cancer Support Helpline at 888-793-9355.